Let's keep people up to date on what is going on in the world of pharmaceuticals. A little couple quick hits of news. The latest here, we've got postpartum depression affects about 500,000 women in the US every year. Some estimates say it's as high as, I think, 18% of all women who give birth, obviously, deal with postpartum depression, which makes it particularly exciting that the FDA has approved the first pill for postpartum depression, Zurzuvae, has shown in 2 double-blind randomized placebo-controlled trials to work quickly, beginning to ease depression symptoms in as little as 3 days, which is much faster than traditional antidepressant medications. Particularly exciting about this, and the fact that it's a pill, is that this can help reduce the stigma of postpartum depression, which will encourage more women to seek the treatment that they could actually use instead of trying to tough it out on their own because they don't want to deal with that. So this is very, very exciting. In other news, a Louisiana woman named Jacqueline Bjorklund is suing the manufacturers of Ozempic and Mounjaro, those being Novo Nordisk and Eli Lilly, respectively. The lawsuit alleges the manufacturers downplayed the severity of the gastrointestinal events caused by the drugs, those including gastroparesis and gastroenteritis. Paresis being when the stomach doesn't contract, right? It's paralyzed, paresis.
Yeah,
and enteritis is swelling.
Yeah, enteritis can just be any sort of inflammation.
Okay.
Infection.
All right.
You know, that sort of thing.
For those that don't remember, Ozempic and Mounjaro are developed to manage blood sugar levels in adults with type 2 diabetes, but have become incredibly popular recently for their off-label uses as weight loss drugs, thanks in part to seemingly miraculous results and celebrity endorsements. Don't get your drug advice from celebrities. Reuters is also reporting for Novo Nordisk that Novo Nordisk has said a large study has shown its highly effective obesity drug, Wegovy, also had a clear cardiovascular benefit, boosting the Danish drug maker's hopes of moving beyond Wegovy's image as a lifestyle drug. The late-stage trial showed that patients on Wegovy had a 20% lower incidence of heart attack, stroke, or death from heart disease compared to those on a placebo. Those are 3 big headlines, those last 2 being related. Tell me your thoughts, Dante.
It is something that I do find interesting because we see the GI side effects in practice all the time.
Yep.
At this point, most people know somebody who is using one of these medications.
Yep.
For good reason. They are working very well. There's obviously tons of shortages going on, so it's just this. We talk about it every other show. It feels like to some level. We'll look back on this in 10 years and 20 years. Be like, wow, do you remember the boom of the GLPs?
Well, yeah, how often does a pharmaceutical come out that everybody knows about?
Yeah, exactly. It is weird. It's the first time I've kind of reflected on it in that way.
I mean,
just how big it's
honestly,
been.
The last time I can think about this was like Viagra was the last one that came out, and everybody knew the name of a drug, which that's kind of a weird thing.
Yeah. In the package inserts of these medications, what's the person doing the suing?
The plaintiff?
The plaintiff,
I believe.
There is no specific warning for gastroparesis. I just assumed that there was. And so I went back and just for the heck of it looked at what comes with the actual medication itself. You can reference these online as well. And it explicitly leaves that out. So given that, they definitely have a case. The thing that I find additionally interesting is that gastroparesis, the diagnosis is a little tricky. So just because you have the symptoms of delayed gastric emptying, let's say, all of the stuff associated with that, there's like the early fullness, bloating, nausea, the weight loss, heartburn. So all of that can occur, but does not mean that there's a specific definition for gastroparesis. So there's additional steps that need done clinically to additional testing basically to confirm this diagnosis. So in this case, I assume she had the diagnosis of gastroparesis, but basically what they do is there's a test to measure how fast the stomach is emptying. And so it has to fall in this specific criteria for it to be considered gastroparesis explicitly. So I just felt basically all of that's to say, this seems like a very gray area.
Yeah.
It's not like she, God forbid, walked away with a, pancreatic tumor or something that was just like, wow, like this occurred. Not to say that this everything associated with gastroparesis isn't devastating.
Right.
It's just it is something that's seems like it sits on more of a spectrum.
Well, I seem to remember Joey talking about describing this medication and saying something to the effect of like, that's functionally what it's supposed to do.
Yeah.
Is delay the emptying of the stomach. So it's almost like, well, yeah, it causes gastroparesis. That's literally what it's supposed to do. It's like, I don't know, getting an epidural and being shocked that your legs are numb. Like, that's the point.
Yeah.
But that isn't to say that that's not a big deal, that can have incredible consequences. And I think what's interesting is a lot of people, any trials or anything that they do, they have all the side effects. They see a lot of this stuff in the trials, but once it hits the mass market and you go from 1,000 people to 10,000 people or 100,000 people, all of a sudden, 2 people experiencing something, multiply that times 100, that's a lot more people experiencing that issue. It becomes a much bigger deal than what it seems like initially. So what's the punchline? I mean, I know we're not making recommendations for people to or not to take drugs, but it seems to me that these are both serious medications, all 3 serious medications, and you need to be aware of what you're doing when you do this.
Yeah.
Right?
Yeah, because again, it is a fine line. There's a spectrum. It's pretty gray when this becomes, again, the side effects that you can maybe expect.
Right.
Or a sign that the medication's working. It can quickly become blurred into, well, I am feeling more full. I'm a little more bloated, but this is supposed to be normal. But then all of a sudden, I feel like you start to shift into acid reflux that you never had before. You shift into more consistent nausea.
Yeah.
Like dull, sharp, aching pain. That's, it's a kind of a stepwise way to get to this a little more seriously. So as soon as you start to notice that, you obviously bring it up to your pharmacist, but at that point you go to the doctor because maybe you escalated the dose a little too quickly. Maybe they can pull you back down.
Up, right?
Yeah. Or maybe this just, again, it's like anything. We're so, we're talking about so much of the good with this medication. There's certainly going to be people who just flat out don't tolerate it. There's a lot of why some of the insurances aren't picking this up on their formulary is because there is a generally high discontinuation rate. So adherence is tough because some people just get pushed to this level of side effect and there's fear of this progressing into a gastroparesis, or, you can't be nauseous all the time and you can't have all this acid reflux. And so, you quit taking it. So it's, again, the punchline is just that it's tough to monitor these side effects. Some of them, it is worthwhile to see through. Yeah. But again, it blurs quickly into some pretty unfortunate stuff.
Yeah. And I just, real quickly, we don't have to belabor the point, but would I be correct in thinking that if you are not the type 2 diabetic side of things, but for folks that are taking these for weight loss, that this really is supposed to be, generally speaking, almost a last straw before something like gastro bypass or something like it's not for, if you need to lose 20 pounds, it's for people who are dealing with morbid obesity and things like that. Is that correct?
For the most part. And like a lot of the, indication criteria is a little, I'd probably have to reference some of that stuff specifically, but
sure.
But BMI over 30, BMI over 27, there's different cut points to look at. But but to your point, it's hard to classify, like how many attempts has somebody made to lose weight? How many diets? How many things have they done? How many other medications? It's tough. I don't know. I think that brings about more of like a philosophical question.
Sure.
That there's like who's to say who is a good candidate versus a bad candidate?
Right.
Do you really need to have a cardiovascular risk factor? Do you really need to have these elevations in blood sugar to qualify? Does it really need to be a last resort? It's tough. I guess I don't have I have feelings, but I don't know what the answer is there.
You have to weigh the risks versus the reward.
Mm-hmm.
It's a trade-off, and you got to decide which is whether or not it's worth it for you in your situation.
Exactly. And it's a long-term commitment, because upon discontinuation, just like kind of the yo-yo dieting thing, there's a good chance that you regain some of the weight that you lost.
Yeah.
So it's a great thing. It's not perfect, but I'm still in the camp that this is going to help a lot of people.
Right.
It's going to continue to help a lot of people.
Very cool.
But that doesn't mean there's also people not misusing it. And,
yep.
This isn't for your summer vacation in 6 months and you
that
just want to drop 8 pounds. It's not, that would be nice, but it's just,
and I think that's part of the point that Novo Nordisk is hoping for, is that with Wegovy, is that it's not a lifestyle medication, air quotes, of going, hey, just be a little slimmer, take this drug. Like this is for a medical issue.
Right.
This is a misuse of this drug completely for weight loss. I mean, it's intended for diabetes.
Well, originally, but the Ozempic and I'm going to speak ultra crepidarianistically now.
Wow. That is a word.
As one of my favorite words. It means speaking outside of your realm of expertise. But Ozempic and Mounjaro were designed for type 2 diabetics who were insulin resistant, had metabolic syndrome issues, but it had this fun side effect of them losing weight. Wegovy is functionally the same thing as Ozempic, correct?
It's the same active ingredient.
And just slight variations
in the dose.
But it does the same thing.
Just basically rebranded.
Yeah.
So it gained the extra FDA approval. That stuff is another complicated. They had to do that basically, but it's just a reflection of the system being a little tough.
Yeah.
But that's how, those serendipitous findings like that, that's medicine is riddled with that sort of thing.
Right.
Whoever developed this, they knew eventually this was going to help weight loss at some point, but it takes a while. It takes a while to figure that out. There were a lot of drugs in this class that weren't great. There were more side effects early on, and now you're getting to, I think, towards the end with some semaglutide and Mounjaro and those sorts of meds. I don't foresee like 50 more of these being made.
New variations that are
like we're towards
radically
the end of
different.
That. And sorry, I don't know if that was all of Josiah's point, but
yeah, no, I was just for someone who knows little about the drug, to be using a drug for weight loss seems like a misuse, like you guys were just clarifying earlier. So I just don't know how that's even possible for people to get it when it's meant for something else. I guess that's the abuse of.
No, doctors prescribe things off label all the time if they know that it's got a side effect, air quotes side effect, a function that happens on the side. There's antidepressants that get used for ADHD. There are all kinds of things like that happen all the time. And it's, we should probably cover that. Like, what is off-label use? Is it okay?
Yeah.
We'll talk about that sometime soon.
Yeah. But Josiah, that's a good question. And what we've kind of talked about, I think, in previous Generation Health episodes, it was that the obesogenic environment, just the current state of obesity as a disease state, more shifting the lens more towards that. There needed to be something big like an Ozempic, Mounjaro to step in, because a lot of what we're doing on a large scale simply wasn't working. Right. And so it was just a matter of time for those meds to get the additional approval. But how that plays out practically is where we are now, just in retail pharmacy, really, is that there's a lot of people who could use this that are now not getting approved because some insurances just won't recognize it because the indication's not there, because this is a $1,000 drug. And so the cost sort of gets in the way of this. The water is muddied for people. And it's like all of a sudden it flipped. And now people, it's like all of a sudden before you could get your doctor to write for it off label and it could slide through on the insurance end. Now insurances are like, these are big audit flags.
Wow.
And so if you don't have the specific indication, they're, trying to cramp down on prescribers and so with the drug shortages now, people can't even get the stuff.
Even if they
it's
could
kind
get
of
it
a
prescribed.
mess. Yeah, it's it's not all because of off-label use, but it's a mess, you know, and it takes time for a drug to not only get approved for a new indication, but then also for an insurance formulary to recognize that indication and start paying for that for people. And so, yeah, I still don't know if that's exactly what you were after.
Yeah, no, yeah.
But that's I think practically how that plays out.